Good afternoon. My name is Ben Kelly, and I'm a physician over at St. Regis Mohawk Health Services. And I'm here this afternoon to talk about, guess what? COVID virus. What a surprise. But seriously, in the last 3 to 4 months, people in Akwesasne have worked hard to keep this COVID virus at bay. And we're somewhat fortunate to live in the North Country where the rate has been low anyway compared to other places. Everyone here has had to sacrifice things like travel, vacations, graduation and birthday parties, weddings, and probably most serious are wakes and funerals. The good news is we have been successful in keeping the COVID virus relatively controlled using simple things like social distancing, washing your hands, and wearing a mask. However, the country as a whole is now opening up again. And as you can see every night on the news, there are, in some of the bigger cities, there are bars and restaurants that are just full of people shoulder to shoulder, no mask, talking away, oftentimes to complete strangers. This is a little bit worrisome, especially since many of these people we see are young people who usually don't have a whole lot of symptoms. So they feel that they probably do not have the disease. One thing I would recommend, if you find yourself in one of these businesses where there are many people without a mask, my suggestion is that you leave and find another place to shop or eat. I know that here in Akwesasne, family and friends are very important, and many times they live out of the area. And I have to say, it's a very difficult time right now for us to receive friends and relatives who live out of the area. And if they must come, it's absolutely required that they do a 14-day quarantine. I know how we like to socialize and see family members, especially elders. This is very dangerous. And if you have family or friends from out of the area who are planning on visiting, this might be a good time to try and postpone it to a later date. I know it's a very touchy area when we're talking about especially wakes and funerals, and you know, I'm not the person to tell you what is right or wrong, but you really need to consider these things very seriously. As everyone knows, there have been incidences of involving people who live here, people who don't live here, and people who sort of live in the surrounding areas. And again, the most scary part is a lot of them have no symptoms. Really makes you sit back and think about these things. And also the very simple things of social distancing, washing your hands, and wearing a mask to protect yourself and the people around you, the people you live with. I know that a couple of times myself, I have a friend who has a boat, and we've been out and we've tried our best to stay, you know, at double arm's length away from each other. The rule of thumb is you should probably try and stay less than 10 minutes from somebody that's not a family member and you don't have a mask. That's sort of your maximum that you can be very near them. So far, I think everyone here has done a good job in the last 3 to 4 months of doing the right thing. We've kept the disease under pretty good control here. But do not be fooled, especially by what you may hear on TV and the radio. This virus is not defeated and it is not gone. One of the things that we all hear about is flatten the curve, meaning that at one point, many of the hospitals were in danger of being overrun. There were so many people that were positive. And it seems like we have, for the most part, beaten that. When you think of health services, there are many people. There are nurses, there are the lab techs, there's the nutritionist, the receptionist, the providers, and how about those young people who are coming out and bringing you your medication out in your car? Most of them are young women, but there's young men too. We really need to think about them. The last couple incidences that have happened that everybody knows about, and I certainly don't want to go into, our clinic has been flooded with dozens and dozens of calls. And I guess that's certainly a way to think of flattening the curve for our health services. We certainly are willing to do everything we can and be available, but with dozens and dozens of calls, oftentimes it's hard to give people that individual service that they've come to expect from us. So I'm asking everybody to certainly be safe. And one more time, wash your hands, wear a mask, keep social distance, think about any activity you're going to do. And I guess last of all, think about who you're going to do the activity with. If you have any questions, please don't hesitate to contact Mohawk Health Services 358-3141. Thank you very much.